So I'm really thankful for him. So I have a challenge now to present after two eminent names in the world. Maybe I will say Dr. Michael Narvi representing Canada, Dr. Saad, of course, our professor in the Gulf area. So it's really a challenge for me. So my case today is a case presentation. Before starting my presentation today, I'd like to change the title now. After I attended Dr. Michael fantastic presentation, when he mentioned age is not a number, I will add another title, weight is not a number. So I'm really happy that Dr. Yahya put the two sessions together, as we will focus here about the weight part of the story. I'd like to ask you, before starting my case, that you are in the ward, the neonatologist in charge, and you receive the call from the gynecologist that, doctor, please, we need your help and decision about one baby, 23 weeks, mother is gravida 2 para 0, she has no babies, she has one abortion, and she estimated weight about the ultrasound was saying that the baby weight is less than 300 grams. So here we wanted to take different opinions from different parts, and it will be two-way discussions because we are sharing the experience. I will start by Dr. Yahya.
More than 22 plus 6, and weight more than 500 grams. Either and or you have to resuscitate.
Okay.
So if you have more than 500 grams, or you are more than 22 plus 6, that's the regulation in Ministry of Health. So we're following it because we're part of Ministry of Health, North America.
So we will take some reply from Egypt, Africa. Mustafa.
It is different in Egypt. I think we are working 500 grams till 24 weeks. However, the mortality of this age group in most of the hospital is very, very high, extremely high actually, because the infection actually, this is okay. In some private centers, well equipped, well trained for this age still working. For 24 weeks, 500 grams, up to my knowledge.
So almost the same like. So Dr. Michael, we will be at the same side, so I will leave you until the end. So anybody from Europe? Latin America? Okay, North America.
I find this fascinating looking at that birth weight of 250 grams. I can tell you just before I came here, we had a baby with an estimated fetal weight of 350 grams. And we were asked what to do. And the group said that that baby would not survive based on us not feeling like we had the equipment to be able to resuscitate. We had one 2.0 endotracheal tube in the hospital. And so we weren't sure, if it became soiled or didn't, or it wasn't working, what we would do. So this is remarkable.
Thank you so much for your valuable reply. And I will go through the presentation, not as usual, because all here are experts in their fields, and they are practicing the most difficult cases, actually. So maybe I will skip some fine details because all of you will know it and because of the time factor. So I will just give a brief note about this baby was born at my previous hospital at 23 weeks, 250 grams, and it was discharged, alhamdulillah, after 5 months and 23 days with this weight 3.8. I hope this video will work. That was day 1.
the chest wobbling, you need to look, okay?
Our colleague, Dr. Wilson. So this baby at day 1, and this at the discharge time at after 5 months and 23 days with the weight of almost 3 kilo. So actually it was 2 years ago, 2020, with 20 challenges. We went through these challenges as a team, actually, because if there is no teamwork, it will never happen, actually. And the nurses before the doctors. So that 20 challenge can make a book of neonatology, actually. And I believe all of you know about what is expected to happen in this tiny babies. Extreme prematurity, sepsis, bruises, anemia, hypotension, abnormal coagulation, hypernatremia, and pneumothorax, renal failure, PDA, ROP, PBD, GERD, and hearing screening issues, chronic lung disease at the end. And we have to deal with all of this problem. And that was the vision from our side as nurses and doctors to the baby. In day 1, will he be able to make it or no? It was really difficult situation because the mother was really having no hope that her baby will do it, because she has previous abortion and that was the first one. So we really felt sorry for this situation. So we will go to the maternal data, which you mentioned, mother gravida 2 para 0, and she has 1 abortion before, GPS positive on the high vaginal swab, and she received dexamethasone 3 doses. That baby was delivered, normal delivery, the Apgar score 306, and was resuscitated by intubation, IBBV, and chest compression, and transferred in the NICU with these settings. And the heart rate was 160, and the saturation was 85 up to 90. So which was quietly good for this weight. So I will not go through each system details because the baby stayed with us maybe 5 months. So we will take a time, but I will be focusing here on the problems which happened in each systems and how we will be able to manage these difficulties. If we are talking about the respiratory systems, the baby started as a high frequency ventilation and went through all the modes of ventilation for the first 40 days, volume guarantee mode of ventilation, CPAP for 40 days, OptiFlow, low flow nasal cannula, and was off oxygen after 172 days. So that was the X-ray in day 1, and that was the X-ray in day 7. So we can see the difference, which is promising a little bit. This, yeah. This photo actually have 2 parts, funny parts and not funny parts. Here, the teacher is asking Shrek, there are 5 cents. But Shrek said, no, I have more. I can hear picture. I believe all of you, when you are seeing this picture, you can hear the sound of the alarms. You can hear the rush of the nurses. You can hear the rush of the doctors. Then that was the story. It was pneumothorax, obvious on the right side. And alhamdulillah, chest tube was inserted successfully, drained. I'm not talking about insertion about chest tube. I'm not talking about pneumothorax. I'm talking about the challenge. You are inserting a chest tube in a very critical sick baby with a very tiny chest. So the baby is like a size of the iPhone. Sorry, 7 days. That was at day 12, sorry. The X-ray, the previous one was at day 7. That pneumothorax happened, unfortunately, in day 12, which was really difficult, or I can say very difficult situation. The baby has the chest tube for almost 12 days, and the drainage was successfully done. The baby received these medications. The other challenges for the respiratory system, we started the medication as dexamethasone and hydrochloroside spironolactones for the protection of the chronic lung diseases. This is Malcolm X, a famous politician and the writer. He said, when I is replaced by we, illness will be wellness. I believe it is applied in any successful unit with a good team. Again, nurses before doctors. So the second challenge was in the cardiovascular system. Also, I'm not go through the details about the cardiovascular system because the baby usually, what do you expect from this baby? That baby initially started 2 bolus of saline, was hypotensive, received dopamine, butamine, adrenaline infusion, Rinone, just to try to keep the blood pressure at the optimum level. Also hydrocortisone. That was not a challenge. Adjustment of the medication, all this is not a challenge. But the challenge is that the baby have large PDA. And all of you know that PDA with this babies, this means that we will not be able to wean this baby from the ventilator. I guess it will be very difficult, even extremely difficult with this wet lung. So the second challenge that this baby went to our hospital in Abu Dhabi, Sheikh Khalifa Medical City. You can imagine the transfer of baby. What do you expect from 12 days old baby who was born to 50 grams? What is the weight now? Maybe less. Of course it is less. Or it is more if we give more fluids, or who knows, but it will be roughly 230 grams. You are moving in the transport, you are, because we have no facility to do the surgery in our hospital, so it has to be in that hospital. So that was really a challenge. And if we are not able to do this surgery, the baby will not be able to make it. So we have no other options. We took the decision that we need to transfer the baby. So that baby went, and we passed the second challenge of the PDA, and it was successfully done. The baby returned back to the hospital, and that was the lines by dates. UVC, UEC, back line from day 6, and that second challenge of the cardiovascular system finished. Yes, doctor. Actually, we explained the whole story. He was on our side, and it was good from him because we explained that we have no other option. Right? I'm not quite sure. Really, I'm not quite sure, but we need to clap for him, really, and for making such yes. So the third challenge is GIT, which was passing. Okay, the baby kept NBO for the first 3 weeks, and full feeding starting on 25 days. After 70 days, breast milk was about to finish. We were lucky to have it for the first 70 days, actually, really lucky, because it protected us from giving formulas or giving hydrolyzed formulas or whatever. So having this breast milk in the first 2 months was really a gift from Allah. So at the 37 weeks and plus 6 days, clinical presentation of GERD happening as expected, and we were able to do handling with it. But the child was in cooperation with us, and he wanted to make it with us. This is not him, by the way, but this is a famous picture in Google. So the fourth challenge is the metabolic system. It was okay, and but we initially have a struggle with the sugar control. It was difficult. This baby has unexplained hyperglycemia, which we couldn't find any reason. We did all the investigation. We tried to manage, but I believe maybe these tiny babies will have a different metabolic system. So we were exploring and we were just handling, and it resolved actually, and we don't know what is the reason until now. He has also jaundice, and will not go through that one. The central nervous system, which is, I believe Dr. Michael have a nice slide about the CP incidence about the 22 weeks, 23 weeks, and the 20 up to 28 weeks. That baby has mild lateral third ventricle minimal periventricular flare was initially done. We did the ultrasound as per our protocol, and the 1 and 3rd and 7, 14 and 28 as per the guidelines. And the term scan at 38 weeks was reported normal, which was really surprise, and we cannot believe that this is happening. So, but every day is passing, every week is passing. We are catching the hope that this baby will pass and we will be able to make the mother happy. So the baby on discharge, the tone, power, reflexes, and the upper and lower limb were normal, and he has a spontaneous smile. Alhamdulillah. So that was the ultrasound on day 14, and that was before discharge. Maybe the picture was not so clear. Inflammation. Also, we were lucky that this baby was not having severe sepsis. So I will be not go through the details of this, but we have two couple of episodes of sepsis, but we were able to handle with it with the proper antibiotics. And at the end, the blood culture and the urine, the MRIC was negative. After some changing the antibiotics, you all know the story. For hematology part, the baby received maybe 19 or 20 times the bagged RBCs, 7 platelet transfusion, 6 FFP transfusion, and it was expected. ROB is the challenge also, and he has received a treatment by laser and by Lucentis injection at 82 days, and he was under follow-up even after discharge, which he was doing fine. She was doing fine, actually, she's a girl. That is a list of the medication given all through the journey. And the screening, maybe that was disappointing for us that the hearing didn't pass, but that baby passed through a difficult time, so it was expected. But on the follow-up, 1 ear passed and the other one was not passing. So I believe maybe with cochlear implants or it can be adjusted. So the moral of the story that we have to never lose hope. But the only one who was expecting that this baby was surviving is the mother, actually, the poor mother. All of us, even she was asking the doctors, we were telling, to be honest, we never see such a tiny weight. Whether he will be able to make it or no, it's not us. We are just the tools. If it happens from Allah. It's just the story that we are just the tools. We are just helping the child. That's it. This discharge weight was 3.83 kilo after almost 5.5 months. And that was the discharge plan, was the discharge medication. I believe it is the same for all the preterm babies, so we will not go through that one. And that was the follow-up with the baby after the discharge with all this multidisciplinary team. I believe most of the hospital having the same plan. And also he was discharged at the season, so we gave RSV vaccine from October to February, and she was doing fine after that. That was recorded as a 250-gram baby, was the tiniest in the Gulf area. but maybe I'm wrong, but the smallest is baby Saibi in California, in San Diego. If anybody from USA, he can reconfirm the information. His smallest recorded baby by Guinness World Record was 245. Named baby Saibi. But our girl is even smaller, because when we took the weight of the baby, we took the weight with the ETT and the cord clamp. Maybe they are 30 or 40 grams, I'm not quite sure. Maybe it is less, but when we took the weight, we were not expecting that he will survive. Wait, just get a weight just to adjust the medication, just normal routine. But the advice is that take the records about this babies probably, because you might be able to do something with your team. This is our team. I am just a small part in this team, and thank you so much. And thank you.